Let's have a look at the Brightsquid Appointment Reminder service. Now, before I jump into the demonstration, I'll warn you ahead of time that I'll be switching back and forth between a couple different points of view. We'll be viewing as a clinic administrator, who for the purposes of today's demo, I'll just call the MOA. We'll be looking at the point of view as to how Brightsquid interprets the upcoming appointments from the EMR. We also may look directly into the EMR to see how things are updating as appointments are accepted or declined, as the case may be. And we'll also be looking at the point of view from that of the patient. So I'll try my best to clearly illustrate who I'm acting as throughout today's demonstration, but just keep in mind those are the 3 points of view we're going to be seeing today. The appointment reminder service is also a web-based application. Really, everything that you'll be doing with your appointment reminders happens through the web interface, and that's what I'll be spending most of the time showing today. So I'm about to log in here, and I'm going to log in as a pretend MOA at a clinic. Once I get logged in, this is the configuration panel for setting up my appointments in my appointment reminder system. Now, before I go any further, I should point out a key component of how this service works. We're not setting up reminders to go to specific patients per se. What I'm going to do and what I'm going to illustrate to you now is the process by which I configure an automation to identify patients who need to be reminded of an appointment that's coming up soon of a certain type. That sounds a little complicated, so let me show you exactly what I mean by that. So if I go to my actual appointment reminder configurations, which we call panels internally, these different panels are different configurations for types of appointments that I want to remind or notify my patients of. So let's take a look at this demo test one that I created earlier today. Let's have a look at how it's configured. So at the top of the screen, we just have the name of the reminder configuration or the panel, a description, whether it's currently active or inactive. But the real important part is right here. So this is the configuration, or these are the parameters by which I want to send appointment reminders to patients who have appointments that meet these parameters. Goodness, that sounds complicated, but it really isn't. Let me show you what I mean. So I have an appointment type, and most EMRs, or at least the EMRs that we connect with, allow your clinic to identify different appointment types. Regular appointment, in this example, PC appointment, VC, I don't know what all these necessarily are, but these are all different types of appointments that this clinic has set up in their EMR. So the Brightsquid system has identified these are available appointment types, and for the purposes of this demonstration, I've selected appointments of the type regular. Furthermore, who's the provider? The relevant doctor in this situation, as will come as no surprise, are doctors Brightsquid. We've just named them Dr. 1, Dr. 2, and Dr. 3, and you can see those are all highlighted here. So far, we're going to send appointment reminders to patients who have appointments that are, quote, regular and are with either Dr. 1, 2, or 3 Brightsquid. The last parameter to identify is the time scale. When do we want to send reminders to the patients? 2 days in advance, 3 days in advance, a week, a month, and so on. For the purposes of today's demonstration, I've selected these 3 time periods, so 3 days out, 4 days out, and 5 days out. You can select up to a maximum of 3 notifications to go to your patients, or reminders if you like, so that they will be advised and reminded of their appointment in good time. So those are the 3 parameters that are going to identify when reminders should be sent to a specific patient. Now, keeping in mind that reminders are going to be sent to the patient either to their email address or as a SMS text message. Those values, the email address and or the mobile phone number, are being pulled directly from the patient profile in your EMR. And how those appointment reminders will look are defined here in the lower part of this of the configuration screens. So the message templates, so you can see here the print is kind of small. Maybe I'll zoom in a little bit. You can see here that there's an email notification template, there's an SMS notification template, and then there's also the secure content that they might see as well. So the first two are pretty obvious. These are the actual messages that patients will receive when they're reminded of an appointment, whether it goes to their email or their SMS text message on their phone. They're essentially the same. These templates are customizable, so you're able to type whatever friendly message you like to have in there, perhaps give additional instructions. The secured content of the message, this is quite an innovative part, is because we're sending the messages to the patients through their regular old-fashioned email or through their non-secure text message, the reminders that they're getting to those two channels are fairly generic. You have an appointment at this place, at this address, at this time. Nothing specific about the particulars of that appointment. No healthcare information. However, there's also an opportunity to include a link to ask the patient to go to our secure location, which they'll identify and log into using their date of birth as a password. And then they're able to see the actual secure content of the message, which might say something more specific about the appointment itself. For example, you have an appointment regarding your wart removal on Thursday, whatever date. Don't forget to take a Tylenol before you come. Again, I'm no doctor. That's just an example as to how that secure content might exist. And then lastly, down here towards the bottom, we can identify the channel priority. So whether you prefer to send SMS text messages or emails to the patient. If the patient has both available in their profile, we'll pick whichever one is selected here. In this case, I've selected email as the priority. If the patient doesn't have an email, it'll automatically send or try to send it to the SMS text message. And the last two options down here, this is quite interesting. In addition to just blanket notifying people of their appointments, we can also ask them to interact and respond with specific information. Specifically, we've built an automatic COVID-19 screening questionnaire so patients can answer questions about their potential COVID exposures. Things like, I recently traveled, I've been exposed to COVID, I'm waiting for test results, those kinds of things. And finally, I've also attached a self-assessment form that I would like the patient to complete before they come in for their appointment. So I've now got my appointment reminders configured and they're ready to go. So still remaining within the Brightsquid interface, I can go down to my upcoming appointments tab. You can see here on the left-hand side of my screen, and I can see all of the appointments that we have scheduled in the very near future. So we can see Bob Brightsquid and all these pretend made-up patients with unpronounceable first names. These are all appointments that are coming up in the very near future. They're scheduled, but you'll notice that they don't say confirmed. Well, some do, but most of these appointments that are for next week are just booked, which is the status in the EMR. And the three that I'm familiar with are booked, confirmed, or canceled, declined. So right now, all of these appointments are simply in the booked status because the patient has not yet confirmed that they're coming. But in a moment, I'm going to show you how that looks. Here we have on my screen a sample email notification for one of our patients. So this is Bob. And as you can see, this is the email that Bob has received reminding him of his upcoming appointment on Monday, October 4th, et cetera, and so on. Again, this is the non-secure email. So it's relatively, well, not relatively, it's completely generic. It doesn't say what the appointment is for. It doesn't hint at any of his health conditions. It's simply a notification that you have an appointment. In order to view the more personal sections of this of the appointment, we ask the patient to view the appointment details via this blue button, which I'll do now. And I'll just maximize my screen here. And to log in to view the actual secure part of the message, I now need to verify my identity. And similar to the way Secure Mail works for registration, we use the patient's birth date for that purpose. So Bob's birthday is February the 8th, 1975. And we go ahead and submit that. And now our patient is viewing the secure component of the appointment reminder. This is where there can be specific information to the patient about what we want them to do. The real call to action is here at the top of the screen, the confirm and the decline buttons. There's also, here's the opportunity to access the COVID-19 screening appointment information. And further down here, we can see things like the specifics of the appointment, the type of appointment could be displayed here as well. And there's also this assessment form that I talked about a moment ago that we're asking the patient to download and fill in and either bring a copy back with them when they come in for their appointment on Monday, or potentially, if they prefer, they can actually log into their Secure Mail account and send that form back through Secure Mail. So there's a lot of opportunity to really prepare ahead of time by having the patients interact and provide as much information as possible. So I'm going to do two things here. First, I'm going to do the COVID-19 screening form for Bob here. So I click on the COVID-19 questionnaire. I put in my name. So this is Bob. Remember, I'm acting as the patient now. I should probably highlight that again. So my name is Bob Brightsquid. And let's see, do I have any of these symptoms? No, I don't have that. No, I don't know anything about an outbreak. And I'll just answer no to all these questions. And no, and no. And then I can submit that. I don't have to download a form and email it back. As a patient, I just submit it and I'm done. So now I can go back to my reminder and I'm going to say, yeah, 8:30 on Monday morning, I'm still available. I'm definitely going to be there. Click confirm. I get a notice that my appointment's been confirmed. So as a patient, I'm now done. As I mentioned before, I have the option to complete this assessment form, which I would then download, either print to paper and then write on it, or fill it in as a PDF form and send it back. So now let us switch back to our doctor's point of view, or the MOA's point of view, I should say. And if I go back to my upcoming appointments and I refresh this view, oops, there's the refresh button. There we go. So let me zoom the screen here again a little bit to show that better. So here, this green bar, this is the patient I was just pretending to be, Bob Brightsquid, 46 years old. His appointment with Dr. 2. It's a regular appointment, and he has confirmed he's coming. And this blue icon here, you can notice at the top of the screen, this is the COVID-19 screening column, and he's passed. So there's no red flags. So as an MOA, at a glance, I can immediately see all of my patients' appointments for Monday, October 4th, which are all these ones here if I highlight them. At a glance, I can see who's confirmed, who's passed or failed COVID-19. If Bob had answered yes to any of those questions, this would be a red lozenge or icon or what have you. I can download and view the exact details of what he said, but at a glance, I can tell who's confirmed and who hasn't yet. Furthermore, the confirmed status has changed here, which if we were to go back to our EMR now and view this appointment directly in the calendar for the clinic, this would also show a confirmed status. So now let's go back to Bob's point of view. And now Bob suddenly gets a phone call that says, hey, we need you to be somewhere on Monday. So Bob notices that he won't be able to make it to his appointment on Monday after all. He can go back in here and change his answer to decline. Have to go to Saskatoon. Let's do that. So we're changing our answer from confirm to decline. And this is a request to cancel the appointment. Now, when Bob confirmed the appointment, it automatically updates through to the EMR to change the status from booked to confirmed. Declination doesn't work quite the same way, because what we hear from most MOAs is they need to be more active or interactive with cancellations. So now when I refresh the screen from the MOA's point of view, you can see here that Bob's appointment is highlighted in red. The patient has requested that to decline the appointment, but the status coming from the EMR is still set to confirmed. So me as the MOA, I now need to go into the EMR and actually cancel that appointment to free up the time slot for someone else to use. The advantage of that is I might want to phone Bob and say, hey, do you want to reschedule for Tuesday instead? Also, in a very busy office, which I'm sure most of you are, when a time slot comes available, I've got a wait list of patients who may want that appointment. So it's really important that we interact with these cancellations directly so that we can reach out to the patients on the wait list and fill this slot so that we're still busy on Monday. All right, so I'm going to wrap up here really quickly. A couple things I wanted to show is in the logs file over here on the left-hand side, we can see all of the appointment reminders that have gone out recently. So we can see in the last couple of minutes, actually, just while I was talking, we can see that things like this one to Bob went out. We have another patient named Vladimir. Looks like Bob got another appointment reminder. We have a lot of tests going on here. This is just my view of appointment reminders that have gone out and which channel they went out through. And then here in the templates section, this is where I actually write those messages that my patients are going to see, either in, in an email or in a SMS message, or the secure content that the patient only sees after they verify their identity and log in. So that's the appointment reminder service in a very short nutshell review. I hope that that answered some questions, or maybe put some new questions in your head that you would like us to answer now. So with that, I'm going to wrap up my little demonstration here, and thanks very much for your kind attention.